Salam Sejahtera and a very warm welcome to our guest of honor, Yang Berhormat Datuk Sri Dr. Adam Baba, Minister of Health Malaysia, distinguished panel of speakers, guests, and live stream viewers from across the country to session 2 of the MMA SCHOMOS Virtual Forum 2021. I am Hari from MMA Sabah branch.
And I'm Senthil from MMA Sabah branch as well. This is the second of a 3-part virtual dialogue series for all government doctors in the country. This is a platform to get your questions and queries answered by administrators and policymakers, themselves from the Ministry of Health, as well as experts from fields of interest mediated and brought to you by the one and only and the largest voice for doctors in the country, the Malaysian Medical Association.
Without further ado, let us invite Dr. Vijay Ganesan, Chairman of National SCHOMOS 2020-2021, to deliver his welcome address. He is a psychiatrist working in Hospital Umum Sarawak and a strong advocate for defending the rights and welfare of government doctors. Dr. Vijay, please.
Thank you. Can you hear me?
Yes, can hear you loud and clear.
Perfect. Thank you. Thank you for the warm introduction, Dr. Sindil Nandan and Dr. Hari. Very good afternoon, Yang Berhormat Datuk Sri Dr. Adam bin Baba, the Minister of Health, Malaysia, Prof. Datuk Dr. Subramaniam, President of the Malaysian Medical Association, Dr. Tirunavukarasu, Honorary General Secretary of the Malaysian Medical Association, esteemed speakers from the Ministry of Health, Malaysia, Dr. Gayatri, a fellow psychiatrist as well, and all fellow doctors. Now, the idea of the MMA SCHOMOS Virtual Forum 2021 was mooted by our moderators, in fact, Dr. Senthil and Dr. Hari, and I was informed about it a few months back. I felt it was a brilliant idea, and why not we do it at a national level instead of at a state level? Now, during the planning of this stage, we felt that it was our first ever virtual forum of such. So let's address doctors' issues and make it beneficial for all doctors to watch from the comfort of your homes. 2 weeks ago, we were more than delighted to know that the Minister of Health himself agreed to officiate our national forum. For the records, our first national event, Doctors' Day 2020, was also officiated by YB. We knew then this wasn't going to be any normal event, but one that was being looked out for. We thank you, YB, for coming and blessing our event. 2020 has been shocking to many of us. None of us thought there was such a thing as COVID. And here we are in 2021 with the rolling out of the COVID vaccines, which was done on time. Thanks again to the Ministry of Health, Malaysia. While we thank the government for the continuous efforts for a healthier nation, there have been some pressing issues that have been haunting our doctors, especially the junior doctors. Now, while the contract doctors are still awaiting news from the ministry and the cabinet on their positions, we do hope that more permanent positions are opened up for doctors in the country. And if posts are filled, there will be a clear pathway for doctors to at least have a chance of pursuing their career, perhaps through the suggested extended contract system as well. Now, the current system does not allow for this, but these doctors have been working relentlessly to save our nation. We are not speaking about a year back, but for the many, many years that have passed and many, many years to come. Well, at this current moment, some have not even visited their families and children in months. Hence, the good news from the ministry in soonest time is most welcomed. We thank the cabinet for also reinstating our critical allowances for all healthcare workers in January 2020 and hope that this allowance remains. Healthcare workers, namely doctors, are a very special group. A group that perhaps don't have lunch times, a group that perhaps can't go home at sharp 5 p.m., and a group that puts patients' health first compared to theirs. Let's hope that this is not seen as a financial burden, but an appreciation for our fellow doctors. The government has also recently made the announcement on the implementation and harmonization of the UD43 posts to be given to medical officers, a move that MMA SCHOMOS applauds and thanks YB himself for pushing for it. We hope that this cohort of medical officers receive their payments accordingly. Now, the last item before I end my speech, which is more of an administrative issue from JPA itself, if we may ask YB himself for, is the leave for all doctors. Now, there seems to be a small discrepancy among the leaves for both contract and permanent medical officers. We in MMA SCHOMOS have been informed that the Ministry of Health is already working on the synchronization of these leaves, and we thank you for it. Now, during this COVID season, for the past 1 year, a lot of annual leaves have been frozen for us to take care of patients, for the majority of healthcare workers during this pandemic, some for many months. There's a real danger that annual leave will be forfeited in the months to come. We hope that all annual leave frozen due to the pandemic be allowed for conversion to salary or to be brought forward at least up to a year after the pandemic comes under control. Once again, we thank you, YB, and the Health Ministry, Kementerian Kesihatan Malaysia, for listening to us. We do hope that SCHOMOS will have more fruitful meetings with the Ministry of Health in time to come for the betterment of all doctors. We have suggested in our previous meetings in regards to having a liaison officer in pertinent departments, the departments especially very well connected to us, who are also here today, bahagian perkembangan perubatan, bahagian sumber manusia, and BPL as well. Now, to make it easier for us to have discussions with the ministry, perhaps this liaison officer can be someone that communicates well with the Malaysian Medical Association and SCHOMOS per se, and we hope that this will be welcomed by YB himself. Now, this event is one that will really benefit all doctors, and I believe having the ministry not only participate but officiate the event is indeed something we are really thankful for. As for my fellow doctors, I understand that there are a lot of hot topics discussed today, and we hope we are not flooded with only critical comments, but instead beneficial questions that may help all doctors. Now, before I end my speech, thank you once again. Thank you so much, Yang Berhormat Datuk Seri Dr. Adam bin Baba, the Minister of Health Malaysia, for coming to our event. In fact, addressing all doctors in Malaysia, and we hope, of course, that we will stand united as doctors and save the nation. Thank you from me.
Okay.
Thank you, Vijay, for the warm welcome to all our viewers and our guest of honor. I could feel that those words did not come out of your lips, but it came out from the bottom of your heart. Let me now get Dr. Harivindan Selapan, my fellow handsome moderator right here next to me, who is the organizing chairman of the MMA SCHOMOS Virtual Forum 2021. He's also the chairman of SCHOMOS Sabah. I now invite him to invite our guest of honor.
Pergi ke farmasi beli ubat selsema. Sayangnya preskripsi tertinggal di rumah. Majlis akan bermula dan tirai dibuka dengan alunan madah yang indah. Dengan serangkap pantun ini, pihak majlis mengalu-alukan kehadiran tetamu kehormat kita pada hari ini. Yang berhormat, Datuk Seri Dr. Adam Baba, Menteri Kesihatan Malaysia. MMA SCHOMOS Virtual Forum ini dianjurkan pada tahap kebangsaan pada ulung kali secara maya. Pada kesempatan ini, pihak majlis ingin merakamkan setinggi-tinggi penghargaan dan ucapan terima kasih kepada Yang Berhormat kerana sudi hadir pada hari yang mulia ini. Dengan segala hormatnya, pihak majlis menjemput Yang Berhormat Datuk Seri Dr. Adam Baba untuk menyampaikan ucapan dan seterusnya merasmikan MMA SCHOMOS Virtual Forum 2021 ini. Dipersilakan.
Salam sejahtera dan Assalamualaikum kepada pengurusi SCHOMOS Malaysia, Saudara Dr. Vijay Ganasan, dan juga moderator Dr. Hari dan Dr. Santil, Yang Berusaha Datuk Dr. Subramaniam Munaindi, Presiden Malaysian Medical Association, yang saya hormati para speakers yang dijemput dan juga pegawai-pegawai kanan Kementerian Kesihatan yang sama-sama berada dalam majlis perasmian Forum Virtual MMA SCHOMOS 2021. Terima kasih saya ucapkan kepada pengacara majlis yang saya hormati semua sahabat-sahabat saya di sini. Lebih dahulu saya ingin memanjatkan rasa kesyukuran kepada Allah SWT kerana atas limpah dan kurnianya dapat kita bersama-sama berada dalam satu majlis pada petang ini. Satu majlis yang memang saya tunggu-tunggukan kerana saya telah dilantik menjadi Menteri Kesihatan pada 10 hari bulan Mac tahun 2020. Maknanya pada 10 hari bulan 3 2021 genap setahun saya menjadi menteri dalam keadaan yang tidak dijangka, terutama sekali kita menghadapi pandemik COVID-19 yang diisytiharkan oleh WHO pada 12 Mac 2020 sehingga kini yang belum lagi selesai. Saya dipahamkan bahawa forum virtual MMA SCHOMOS 2021 ini merupakan program yang julung-julung kali diadakan yang menjadi platform kepada para doktor untuk mendapat penjelasan mengenai latihan dan amalan sebagai pengamal perubatan di sektor awam dan juga di negara yang kita cintai ini, Malaysia. Selain itu, semua yang hadir dapat berkongsi pandangan dan para doktor khususnya boleh mendapatkan nasihat serta panduan mengenai perkara-perkara berkaitan dengan pembangunan kapasiti dan kerjaya sebagai seorang pengamal perubatan. Ingin saya maklumkan ucapan perasmian saya menjurus kepada persoalan-persoalan yang telah pun dikemukakan oleh kepala doktor dalam mesyuarat sebelum ini ataupun soalan-soalan yang telah diajukan kepada kementerian berkenaan dengan perkara yang berkaitan seperti yang disebutkan oleh Presiden SCHOMOS tadi. Saya dipahamkan bahawa antara perkara yang akan dibincangkan dalam forum ini adalah mengenai kedudukan sebagai pegawai perubatan kontrak, penyelarasan grade jawatan, kemajuan kerjaya, pengajian kepakaran, pelindungan insurans dan medico-legal serta beberapa isu yang lain. Hadirin yang saya hormati sekalian, saya juga ingin mengucapkan syabas kepada MMA SCHOMOS kerana penganjuran program ini memberi manfaat kepada para doktor. Tadikala kita masih lagi berada dalam tempoh perintah kawalan pergerakan. Platform secara virtual ini dapat menemukan semua para doktor yang terlibat bagi perkongsian maklumat mengenai pengalaman perubatan dan perkembangan sektor kesihatan di negara ini. Biar saya mulakan dengan diri saya. Saya merupakan graduan perubatan daripada Universiti Malaya pada tahun 1987. Di waktu pada itu secara kritikalnya, graduan doktor memang sangat diperlukan untuk bekerja di sektor awam. Saya telah menjalani proses housemanship yang mana memberi latihan yang mencukupi kerana dalam Akta Perubatan 1971 menyatakan bahawa setiap yang graduan daripada fakulti perubatan dalam negara dan luar negara adalah dikehendaki untuk mendaftar dengan MMC dan juga perlu berkhidmat dalam sektor awam selama berapa masa untuk menjadi doktor. Dan selepas completion of my housemanship, kita diberikan satu lagi dalam Akta Perubatan 1971, iaitu kita mestilah dilatih supaya mendapat kecukupan pengetahuan sebagai medical officer sebelum kita menghalakan kerjaya kita, sama ada meneruskan peluang kerjaya di sektor awam ataupun seperti saya telah membuat keputusan untuk berada di sektor swasta seawal karier kerjaya perubatan saya. Untuk itu, evolusi sektor kesihatan seperti mana yang semua sedia maklum, sektor kesihatan di negara ini telah berkembang pesat. Bermula daripada pengujudan hospital Taiping atau hospital Yonghua pada tahun 1880 bagi memenuhi permintaan setempat pada masa itu, iaitu perkara yang dirawat pada waktu itu ialah merawat penyakit seperti cerit-berit, taun atau kolera, malaria, penyakit biri-biri, disentri dan penyakit paru-paru. Sebelum perkhidmatan kesihatan mengalami perluasan yang kini tersebar di seluruh pelosok negara. Penyedia perkhidmatan kesihatan tidak lagi terhad kepada fasiliti kesihatan yang disediakan oleh KKM sahaja. Malah pihak Universiti Awam, our IPTA, dan juga swasta, fasiliti swasta dan badan-badan bukan kerajaan turut memainkan peranan aktif menyediakan perkhidmatan perubatan dan kesihatan kepada rakyat. Peruntukan keuangan tahun 2021 yang terkini, hadirin sekalian, suka saya berkongsi beberapa perkara penting mengenai KKM agar semua yang hadir memahami situasi dalam sektor kesihatan yang kita kasihi ini. Pertamanya, mengenai peruntukan bajet yang diberikan kepada Kementerian Kesihatan pada tahun 2021. Kerajaan telah memperuntukkan sejumlah bajet berjumlah 31.9 bilion ringgit Malaysia kepada kita di KKM. Peruntukan ini lebih tinggi sedikit berbanding dengan tahun 2020 dan bajet pada tahun-tahun sebelumnya. Daripada jumlah tersebut, sejumlah 27.2 bilion diperuntukkan di bawah belanja mengurus, iaitu operating expenditure, dan bakinya diperuntukkan bagi belanja pembangunan, iaitu development expenditure. KKM juga diberikan peruntukan tambahan lebih daripada 3 bilion ringgit bagi pemulihan vaksin COVID-19, yang mana nanti kita boleh bincang dengan pegawai-pegawai kanan kementerian, jenis dan juga kedapatan vaksin sehingga kini. Dengan kelulusan ini, KKM telah memulakan proses perolehan vaksin dengan vaksin Pfizer dan menggerakkan pelan imunisasi kebangsaan vaksinasi COVID-19 kepada petugas barisan harapan dalam fasa pertama. Diikuti dengan fasa kedua dan juga fasa ketiga serta fasa kawalan wabak sekiranya diperlukan sebagai mengawal dan juga mencegah jangkitan COVID-19. Selain itu, peruntukan juga disediakan untuk urusan lain seperti peruntukan bagi pembelian reagen PCR gold standard, rapid test kit sama ada rapid test kit antigen ataupun rapid test kit antibody. Kita membeli juga consumable dan juga aset bagi klinik-klinik serta fasiliti kesihatan dan juga zon-zon saringan. Untuk petugas Kementerian Kesihatan Malaysia, tuan-tuan dan puan-puan, untuk makluman, kini KKM mempunyai sejumlah 252,911 petugas tetap dan sejumlah 40,000 petugas kontrak. Maknanya kita ada 292,911 petugas yang meliputi pelbagai skim perkhidmatan. Sebahagian daripada petugas yang kita ambil sebagai petugas kontrak ini dilantik bagi memenuhi syarat latihan siswazah dan khidmat wajib antaranya. Manakala sebahagian lagi dilantik bagi memenuhi keperluan perkhidmatan semasa dalam membendung penularan COVID-19 ini. Berikutan dengan pelaksanaan dasar kawalan saiz. Sekarang kita menggunakan pendekatan right sizing. Sebelum ini downsizing. Kerajaan sejak mula 10 hari bulan 3 2020 kita menggunakan perkataan ataupun kawalan dasar right sizing, iaitu kawalan saiz yang sebenar. Dalam perkhidmatan awam, penjawatan tetap tidak lagi dipertimbangkan melainkan dilaksanakan secara tukar ganti, trade off. Walau bagaimanapun, dengan kekuatan yang kita ada berdasarkan pada permohonan pada 5 tahun 2019, KKM telah mendapat kelulusan bagi sejumlah tambahan 10,675 penjawatan baharu secara berfasa, bukan sekaligus, iaitu secara berfasa menerusi pendekatan trade off, iaitu jawatan sama ada dari KKM ataupun kementerian-kementerian lain. Berdasarkan jumlah keseluruhan petugas ini, Kementerian Kesihatan Malaysia perlu membelanjakan sejumlah lebih 17 bilion ringgit Malaysia ataupun bersamaan dengan 63% bajet tahunan bagi pembayaran gaji daripada peruntukan belanja mengurus, operating expenditure. Jumlah ini belum lagi termasuk bayaran allowance lain yang dituntut seperti bayaran lebih masa dan allowance kerana bertugas rasmi yang lain. Tuan-tuan dan puan-puan, secara perbandingan jumlah tunggakan gaji ini ataupun jumlah tanggungan gaji ini oleh KKM adalah lebih tinggi berbanding dengan negara-negara lain dari segi salary atau wage of government health expenditure. Sebagai contoh, daripada 18 negara di Eropah yang diteliti, kita dapati purata jumlah tanggungan gaji di negara tersebut adalah sekitar 42%, berbanding dengan kita 63%. Daripada bajet kesihatan yang diluluskan, daripada 64 negara di dunia yang diteliti, purata tanggungan gaji adalah sekitar 42%. Tetapi di negara kita, jumlah tanggungan gaji adalah 63%. Fasiliti yang tersebar di seluruh negara, KKM memiliki 146 hospital dan institusi serta lebih daripada 3,300 jenis klinik di peringkat komuniti. Sebahagian telah pun berusia dan tentu sekali memerlukan penambahbaikan. Memandangkan fasiliti Kementerian Kesihatan Malaysia tersebar meluas di seluruh pelosok negara, maka pengurusannya sudah tentulah kompleks dan tentu sekali memerlukan lebih perhatian dari segi selenggaraan dan juga lebih lagi peruntukan kewangan untuk tujuan itu. Sehubungan dengan itu, kami memohon kefahaman daripada semua pihak, terutama SCHOMOS MMA, mengenai keadaan ini, khususnya mengenai kekangan untuk KKM dipertimbangkan penjawatan tambahan dan juga peruntukan kewangan. Ini kerana selain KKM, kementerian lain juga memerlukan sumber manusia dan peruntukan di mana akhirnya kerajaan kita perlu menimbang semula permohonan tersebut berdasarkan kepada keupayaan semasa. Tetapi untuk mereka yang baru bergraduan, yang pada ketika 5 tahun ke belakang pasaran kerja tidak menyamai dengan keluaran daripada graduan universiti. Ini yang menyebabkan kita telah berusaha menempatkan hampir dalam masa yang tertentu untuk mereka dapat menjalani program housemanship. Selain itu, kefahaman penting bagi memastikan sumber-sumber yang terhad dalam organisasi dapat dioptimumkan secara bersama dengan langkah-langkah penjimatan. Pelaksanaan program kita mestilah lebih fokus. Peringkat petugas kesihatan pula dan dapat bekerjasama secara inklusif berteraskan konsep whole of government and whole of society approach. Tuan-tuan dan puan-puan, fokus baru KKM. KKM akan memberi tumpuan kepada beberapa keutamaan penting dan strategik. Antaranya menggerakkan gagasan yang penting, iaitu perkara yang dicetuskan oleh saya pada tahun 2020, iaitu Agenda Nasional Malaysia Sihat. Agenda ini merupakan salah satu strategi terutama sekali post-pandemik, seperti memastikan rakyat terus sihat, menerusi amalan penjagaan kesihatan, serta aktiviti promosi dan pendidikan kesihatan seperti menawarkan modal literasi kewangan untuk kesihatan dalam kalangan kanak-kanak, remaja dan golongan dewasa. Bagi maksud pelaksanaan agenda ini, KKM telah memperuntukkan bajet tambahan bagi pelaksanaan program untuk memperkasakan lagi amalan dan gaya hidup sihat di negara ini. Fokus baru KKM juga diberikan kepada usaha mengurangkan kes kejadian jangkitan COVID-19, iaitu melaksanakan pengesanan dan contact tracing dan melaksanakan pelan imunisasi kebangsaan yang sedang digerakkan sekarang dengan bantuan dan sokongan daripada agensi lain di peringkat akar undi. Pendaftaran melalui Mas Sejahtera dan menerusi kaedah lain telah mula dibuka dan pusat-pusat vaksinasi akan dibuka secara berperingkat dalam tempoh beberapa bulan ini. Proses vaksinasi telah pun dimulakan dengan usaha memvaksinasikan petugas barisan hadapan, khususnya petugas-petugas kesihatan secara langsung yang terlibat dalam skop pengurusan COVID-19. Dalam hal ini, kami juga ingin mendapatkan kerjasama tuan-tuan dan puan-puan para doktor agar dapat mendidik dan menarik lebih ramai individu dalam masyarakat mendaftar melalui aplikasi Mas Sejahtera, talian hotline kementerian ataupun MKN, mendaftar di fasiliti KKM secara bersemuka untuk mendapatkan suntikan vaksin COVID-19 seperti mana sasaran yang ditetapkan oleh kerajaan. Agenda lain yang saya akan diketengahkan dalam memperkukuhkan KKM adalah memperkukuhkan perkhidmatan prima ataupun primary care sebagai perkhidmatan pertama bagi mendapatkan rawatan sebagai langkah untuk mengurangkan kedatangan pesakit ke hospital dan bebanan serta kesesakan di hospital serta klinik kita. KKM berharap dengan pendekatan inklusif ini, kejayaan bagi pelaksanaan program-program di KKM bukan lagi semata-matanya bergantung kepada pertambahan semua manusia dan peruntukan keuangan. Malahan kesediaan semua pihak, khususnya dalam KKM untuk berkongsi sumber yang terhad, mereka kaya yasa prosedur dan mengamalkan inovasi dalam penyampaian perkhidmatan kepada rakyat merupakan satu enabler kepada kejayaan yang kita inginkan. Ajakan ini adalah selaras dengan hasrat Yang Amat Berhormat Perdana Menteri Tan Sri Mahyudin Yassin yang ingin melihat transformasi dilaksanakan terhadap sistem kesihatan sebagai satu new deal atau tawaran baru pada rakyat yang selari dengan matlamat yang digariskan di bawah Kawasan Kemakmuran Bersama 2030. Dan dalam hubungan ini, KKM sedang merangka satu plan strategik pendigitalan KKM yang akan menggariskan hala tuju baru pendigitalan dalam menyampaikan perkhidmatan di KKM yang mana mengambil kira norma baru perkhidmatan termasuk menggunakan perkhidmatan dalam talian, aplikasi dalam talian seperti mobile apps dan artificial intelligence dan sistem elektronik medical record yang berkeupayaan menyediakan lifetime medical record yang telah pun dimulakan dalam fasa ini di Negeri Sembilan. Usaha juga akan dibuat bagi menyediakan perkhidmatan yang lebih dinamik, pantas dan berfokus pelanggan, iaitu customer centric, menerusi jalinan kolaboratif strategik awam swasta, termasuklah memanfaatkan penyumber luaran, iaitu outsourcing, dan penggunaan teknologi perubatan terkini yang dimiliki oleh fasiliti kesihatan swasta dalam perawatan pesakit. Dalam hal ini, prinsip neutrality dan impartiality, tuan-tuan dan puan, dituntut. Sebagai penyawat awam, prinsip ini sewajarnya menjadi mantra yang perlu diamalkan pada setiap masa. Fokus kita adalah memastikan perkhidmatan yang diberikan tanpa mengambil kira faktor kaum, geografi, agama dan fahaman dalam kalangan masyarakat. Dalam hal ini, saya ingin menasihati agar pandangan dan maklum balas boleh disampaikan kepada kita, tetapi mengikutlah saluran yang telah disediakan agar maklum balas atau intervensi dapat dilakukan sewajarnya. Yang penting, kita perlu menanam sikap menyayangi organisasi kita. Sebagai Menteri Kesihatan, saya akan mengambil perhatian sewajarnya mengenai isu-isu yang telah dibincangkan dan akan dibincangkan dalam forum ini nanti. Dalam masa yang sama, saya juga ingin memaklumkan bahawa KKM telah pun melaksanakan langkah untuk menyelesaikan beberapa isu yang membelenggu para doktor seperti mendapatkan kelulusan kerajaan bagi pelarasan grade jawatan grade UD 43 kepada pegawai kontrak, yang mana selama setahun saya bersama KKM berjuang untuk memastikan pihak kerajaan dapat memenuhi kehendak kita, dan alhamdulillah pada 25 Februari 2021 yang lalu kita telah pun mendapat keputusan bahawa pelaksanaan ini boleh dilaksanakan dan bolehlah mereka yang terlibat merujuk kepada sistem e-placement. Selain itu, Kementerian Keuangan juga telah bersetuju dalam kita merangka melanjutkan tempoh kontrak kepada pegawai perubatan, pegawai pergigian dan pegawai farmasi yang akan tamat kontrak pada pertengahan tahun ini. Tawaran akan dibuat kepada pegawai KKM untuk disambung selama setahun lagi. Sebelum kita membuat satu keputusan yang besar, iaitu dari masa ke semasa akan mengemukakan permohonan kepada agensi pusat untuk mempertimbangkan tambahan jawatan, mengambil kira keperluan perkhidmatan di fasiliti baru, naik taraf dan juga fasiliti sedia ada. Dan selain itu, KKM bercadang untuk memohon dengan kerajaan supaya pelantikan secara kontrak untuk tempoh yang lebih lama seperti yang telah pun dimohon. Perkara ini telah di peringkat akhir penelitian sebelum KKM membawa cadangan ini untuk pertimbangan kerajaan. Sebagai penutup, sekali lagi tahniah kepada MMA SCHOMOS yang mengambil inisiatif yang amat bagus untuk membantu para doktor menerusi penganjuran program seperti ini. Saya harap audien yang ada pada hari ini dapat mendengar ucapan saya kerana bukan senang untuk kita bertemu di kala pandemik ini. Alhamdulillah, saya telah melawat ke semua negeri, bertemu dengan Jabatan Kesihatan Negeri termasuk pengarah hospital secara maya, dilaksanakan selama 6 bulan. Dan kini saya bermula menemui para pegawai kesihatan daerah setiap negeri dan telah bermula di Selangor, wilayah Persekutuan dan Labuan. Dan kita akan teruskan untuk bertemu dengan semua PKD di negeri-negeri lain selepas ini. Kami juga mengharapkan hubungan yang positif dan baik antara MMA SCHOMOS dengan KKM bagi menyelesaikan pelbagai isu berbangkit menerusi proses pembincangan dan perundingan yang wajar. Pada masa yang sama, teruskanlah tugas kita untuk mematuhi SOP dan peraturan yang ditetapkan, dan juga kita mengambil maklum tentang ordinan darurat yang sedang dilaksanakan untuk membantu kita menangani COVID-19 sehingga 1 hari bulan 8 2021. Selepas itu kita yakin ordinan darurat ini akan ditamatkan dan kita akan kembali kepada keadaan biasa, dan insya-Allah kita boleh berjaya. Kita jaga kita mesti menang. Dengan lafaz bismillahirrahmanirrahim, saya merasmikan forum virtual MMA SCHOMOS 2021 pada kali ini. Sekian, terima kasih. Thank you very much for all.
Okay.
Terima kasih yang berhormat atas kata-kata aluan yang memberi galakan dan sokongan yang padu kepada para pekerja barisan hadapan negara kita. Presiden Persatuan Perubatan Malaysia, Profesor Datuk Dr. Subramanian Muniandi, ingin sangat menyampaikan sepatah dua kata pada hari ini. Akan tetapi beliau menghadapi beberapa masalah teknikal dan tidak dapat bersama kita pada waktu ini. Persatuan Perubatan Malaysia, Presiden dan pihak majlis mengambil kesempatan ini untuk merangkapkan ucapan terima kasih kepada Yang Berhormat kerana sudi meluangkan masa untuk menyempurnakan majlis perasmian forum ini.
Here we are today at the second session of the MMA SCHOMOS Virtual Forum. This is the second of a three-part series that will take place over the 3 consecutive Sunday afternoons. For those who have not registered, please do so at the link below so that we can keep you posted about the sessions and the speakers. For those who are unable to attend the sessions, the recordings will remain available for viewing later through our Facebook and YouTube page. Now, Sandil, we want to engage the viewers and make this an interactive session. We'll be using the AHA Slides platform for live polling, so please scan the QR code that I'll show shortly and or access the links given.
AHA Slides, huh? Sounds like an aha moment. So it's ahaslides.com/MSVF, as you can see at the top of the screen.
As you can see at the top of the screen, on the top right corner, that's the QR code. So please scan the QR code or access the ahaslides.com/MSVF. Let's do some warm-up questions, shall we?
Yes, we shall. Let's try it out.
Okay, Sindel, let's find out what is the demographic of our viewers today. So, how old are you? So, as our viewers answer the questions, it'll appear live.
Maybe we should change the question a bit and say, how wise are you?
So far we have about 30 out of 200 old viewers that have answered. And at the moment, the majority of our viewers are in the younger age group, the 20 to 40 years old age group. Where are our wiser viewers?
Amazing participation there. The numbers are increasing. We have 71 people on AHA Slides and close to 200 people watching us live now on YouTube and Facebook. So the 130 of you all who haven't logged in, please do so. We have few more interesting questions to go through.
And out of the many who registered their interest to participate in this forum, about close to 60 to 70% of them were in the group of medical officers, house officers, medical students, and medical graduates. So these are the younger demographic of our government doctors in service. Whereas the remaining 15% of them were specialists and consultants.
This must be because of the topics that we will be addressing today.
So I hope you can access the AHA Slides link and test out the next few questions that we'll be putting up. So let's move on to the next question. Which state are you currently working in? So let's have a look at the spread of our viewers across the country.
Type in your state, and the commonest state that is typed in will appear bigger, right? So let's see which state will win this little competition.
Sabah is apparently the most viewerships are from Sabah, followed by Selangor.
Come on, everybody.
Looks like we have a big following in Sabah.
Yep, Selangor is up next.
Followed by Sarawak. If you like to see your state grow bigger, please get your colleagues to join in the forum and key in and answer the questions. So a majority of the viewers are from Sabah, Selangor, Sarawak.
It's a tight competition there between Sabah and Selangor. Come on, Sabahans. I'm sure you can do better than that. Okay, I see 1, 2, 3, about 12 to 13 states. Some have mentioned cities. Putrajaya, Penang are some of the cities that they have mentioned. Okay, numbers are increasing. We have 101 people on the AHA Slides platform. That's good.
And we have about 213 live viewers at the moment through the Facebook as well as YouTube live platform. Now, let's move on to the next question. Why did you choose to attend this virtual forum? Is it to get updates on live info or latest info? To clarify with Ministry of Health and JKN policies on matters? Or is it to enjoy membership promo gifts?
We'll give you a few more minutes to answer that.
As you know, Sandil, during this live forum, we are also having a membership promotion for all new members and for those current members who are signing up for live membership. So this is a perfect platform for them to get extra promotional gifts.
Oh, wow. Really?
And
I wish I didn't sign up that early. Now I feel like signing up again.
And do you know what are the gifts we have in mind for them?
Oh, tell me.
Well, for those who are signing up for live membership, we're actually offering personalized medical scrubs. And for those who are signing up for ordinary membership, they'll be getting a 2 terabyte USB thumb drive with a lanyard.
Did I hear you right? 2 terabyte?
Yeah, that's right. 2 terabyte beautifully crafted thumb drive.
And when you mean personalized scrubs, does it mean like it comes with my name embroidered on it?
Exactly.
Wow, that sounds so tempting.
So now you can see, based on our viewers' response, the majority of them are actually here to get updates on latest info as well as clarify policy matters from JKN and MOH. So looks like the membership promo was only a small part of the contributory factor.
I guess after all, it's not about scrubs and thumb drives. It's about the voice of doctors as a whole.
Now, what were the challenges that you faced? Was it a lack of personal knowledge on relevant matters, a lack of easy accessibility to information and policies, or is it a lack of a one-stop platform to obtain updates on pertinent issues? So this will be a very interesting graphical representation of our viewers' answer. So those on the side of the 5, they'll be strongly agree, whereas those on the side of 1 will be strongly disagree. So let's see.
It's very satisfying to see the graph skewing towards the right, which is more towards strongly agree. I suppose the average is shown in that 3 little circles there for the 3 questions. Lack of personal knowledge on relevant matters, 3.7. Lack of easy accessibility to information and policies, 4 to 4.1. Lack of one-stop platform to obtain updates on pertinent issues, 4.4. Seems like this forum is really relevant.
Yes, and at the moment, we have about 300 live viewers, but only about 70 to 80 of them have answered on our slides. So what happened to the rest of the viewers? Come on, be interactive, join us, let us know your views. All this is live, and our health minister is watching as you answer. So let him know what you feel. Now, Sandil, a few housekeeping announcements before we move on to the next speakers. Please put up your questions for live Q&A on AHA Slides instead of through Facebook or YouTube. You can do this anytime during the forum. You can view questions listed by others. This will allow us to group and rank the questions according to popularity. For those signing up for membership promo, please note that a QR code and a unique link to a Google form will appear at random for proof of attendance. So please don't miss that.
So if you're on AHA Slides and you see someone has already posted a question that you wanted to ask, don't post the question again, but instead like that question. So when a question gets more likes, it will move up the ladder. It will become a more popular question. And the popular and prioritized questions are the ones that we will choose to address later. So make sure if you have a similar question, don't type in the question again, but just simply like the question that the other person has asked. While you do that, let's watch a short video on what exactly the Malaysian Medical Association and SCHOMOS is.
Now, that's the role of SCHOMOS in a nutshell. So for the non-members out there, this is the time to sign up and let your voice be heard. One of the sponsors for today's session is the Malaysian Palm Oil Council, MPOC. Let's take a quick break and hear from them in their effort to boost promotion for the palm oil industry.
Asalnya Nun dari Afrika Barat. Tiba di Melaya dengan nilai tersirat. Mulanya menawan menghiasi laman. Semakin menyerlah dengan tukaran zaman. Sawit, nama yang cukup berharga. Minyak diperolehi didagangkan ke dunia. Minyak sawit penuh nutrisi. Ketahanannya pasti di suhu tinggi. Juadah lazat rasanya asli. Hadirnya tidak mudah ditandingi. Kini tampil mampan berkualiti. Sungguh gah sumbangan ekonomi. Inilah sawit membawa untung. Ribuan pekebun tumpang bergantung. Syukur dilimpahi rezeki berpanjangan. Anak-anak menimba ilmu, menempa kejayaan. Dengan kajian dan penyelidikan berterusan, sawit dihargai untuk pelbagai kegunaan. Daripada barangan bukan makanan, kesejahteraan tubuh badan. Sawit, nadi kehidupan Malaysia. Industri sawit adalah milik kita. Inilah sawit, penuh keunggulan. Inilah sawit, anugerah Tuhan.
I started teaching at university in 1959. I worked in the university for about 22 years, two different universities. University of Malaya is the premier university in Malaysia. And then second university is the second one most famous in Penang. So I worked for the, and when I was in USM, University of Science Malaysia, I was invited to join the Palm Oil Research Institute. Palm oil, first of all, is an edible oil. Has been used in Africa, in Egypt, 5,000 years ago. So most of the oil is used as food, you know. 90% of the oil is used for food. In Asia, many of our foods we like to fry, you know, and it's a very stable oil. It doesn't go rancid, oxidation. It doesn't attack by the air. With regard to the brain, of course, the palm oil is a micronutrient. It's a nutrient you need for health, for your human need. You need carbohydrates, you need fat because for your vitamins, and you need proteins. No? So palm oil is a good source of your fat. It's stable, it don't affect your heart, but palm oil is not a drug to cure some, but palm oil has a number of phytonutrients, and you have met the work done on tocotrienol. Tocotrienol is present as a phytonutrient. We have produced red palm oil. You see, it's on the shelf, called carotenoid, and it's full of pro-vitamin A. I've done some work on this. You take a lot of vitamin A, it's called, you might suffer from hypervitaminosis. You may have some side effects. But if you take carotene, pro-vitamin A, you have no side effect. The body will only convert vitamin A when it needs it. And of course, those who consume will have rosy cheeks. Nature has provided a perfect structure for palm oil, make it doesn't raise blood cholesterol, and make our ladies all beautiful, less fattening.
Okay, watching that video tells us that consuming palm oil gives you rosy cheeks. So, okay, moving on from there, let's start off with the much-awaited dialogue session with our invited panel of experts from Bahagian Sumber Manusia, Kementerian Kesihatan Malaysia. We have with us today the dashing Encik Zainal Al-Akab Seman, Setiausaha Bahagian, Grade Jusabi. We also have Encik Shahman bin Jalaluddin, Ketua Penolong Setiausaha Kanan, Grade M52, from Unit Perkhidmatan Pengurusan dan Profesional 1. We also have our gorgeous Puan Fazidah binti Fadzil, Ketua Penolong Setiausaha Kanan, Grade M52, from Unit Skim Saraan and Hubungan Pekerja, SSP. Welcome everybody. We welcome you to this interactive dialogue session, which will be conducted as a rapid fire session. So we will ask the questions and answers. So it's going to be a question answer format. As we go through the questions, we will also project the relevant slides from Bahagian Sumber Manusia when the relevant topic is being discussed. So over to you, Hari.
Okay. Can you start the first question?
Okay. We're just getting the slides ready. Okay. Question number 1. As a contract medical officer, what are my entitlements and benefits? And how is it different between the contract medical officers and the permanent medical officers?
Okay. Assalamualaikum warahmatullahi wabarakatuh, and very good evening. So, you hear me, Dr. Senti?
Yes.
Loud and clear.
Yes.
Loud.
Okay. Thank you. So, thank you for inviting us in this virtual forum. So, basically, we actually we have already prepared the slide for in order to help in this discussion. So actually, for the first question about the benefit, we can see that currently in public service we have 3 types of appointment for the audience to know. So the first one is the permanent, and the second one is the contract basis, and also the third one is temporary. So basically for permanent, of course the benefit is actually much more because of the terms that we offer as a permanent. And of course for the contract, the terms is quite short, and basically a maximum to 3 years for one contract. So basically, based on that kind of arrangement, so for the contract officer, so the government has published one circular, which is circular, if I'm not mistaken, the circular is number 2, 2008. So basically, okay, yeah. 2008. So basically, in that circular, we can see the benefit that we can offer to contract officer. Actually, because of we think that at that time in 2016, we try to make sure that we take care of our medical officer, dentists, and pharmacy. So we try to apply to the JPA, so that JPA can consider 3 extra benefit for them. The first one is pelantikan yang boleh dikebelakangkan lah, which is if we consider we consider the officers to be a permanent, so we can backdate their appointment on the same date on the contract, at the first day of the contract. So the second one is the from 15 fully paid medical leave, we try to increase into the maximum of 90 days in a year. And the third one is we try to ask JPA to consider to give their parent medical treatment in government hospital in the country. So that 3 extra benefit that we give to medical and also dentists and pharmacists right now. So actually, based on the emolument, the emolument that received by the contract officer is similarly or equivalent to the permanent officer. But right now, after we send, and also we try to ask the government to consider at least after two years, they consider as a 43. They are considered as a 43. So the government has approved it, and currently we trying to offer based on phases to the medical and also dentists lah. So right now the process is still going on until the next cohort. And other than that, other benefit that we offer to contract officer is cuti lah, cuti rehat 25 hari, cuti haji tanpa gaji, cuti sakit 90 hari bergaji penuh, cuti bersalin, cuti rekod tanpa rekod isteri bersalin, and cuti tanpa rekod kematian ahli keluarga terdekat lah. And then some more, it is about we offer also the medical treatment for officers and their families, and also their parents, and based on the availability, of course, the quarters, and also pinjaman komputer untuk kenderaan. That's all for now. Thank you.
Thank you, Tuan Zainal. Another question would be, am I eligible for unrecorded leave if I'm sitting for an exam relevant to my career progression?
So, Puan Fazila, can you assist me to answer that question? Puan Fazila.
Hello, Doctor. Yes, saya. Okay, thank you. Can you hear me?
Yep,
Yes.
loud and clear.
Can you hear me, Doctor?
Yes, loud and
Okay,
clear.
okay.
Puan Fazila.
Regarding kemudahan cuti mengambil peperiksaan, currently peraturan semasa menetapkan hanya pegawai kerajaan lantikan tetap layak mendapat kemudahan cuti mengambil peperiksaan. However, bagi pegawai lantikan kontrak, pegawai boleh menggunakan kemudahan untuk mendapat pelepasan paruh hari untuk melaksanakan atau mengambil peperiksaan di mana-mana tempat sekiranya peperiksaan itu kurang daripada 4 jam sehari. Tapi sekiranya tempoh yang diperlukan adalah lebih, pegawai dinasihatkan mengambil cuti rehat yang berkelayakan. Sebagaimana Tuan SB sebut tadi, out of 25 days per annum.
So actually, it is based on the head of
That's all.
department, Doctor.
Anything I can clarify further?
Of course, there are two kind of arrangement here. The first one is head of department can allow the officer to take at least maximum 4 hours in a day in order for them to take the exam. Or if the numbers of days is more than 1 day, maybe the officer can take their annual leave. Okay.
Okay, moving on to the third question. I think this question was partially answered by Tuan Zainal earlier. Regarding the harmonization of grades UD 41 to UD 43 for contract MOs. As Tuan Zainal mentioned, it's already in process. So can we look at the dates and the cohorts? And the next question related to that is, will the harmonization to UD 43 be backdated to the start of my MO-ship?
Okay. Of course, we trying to ensure that all medical officers, which is still in contract, we can offer them based on the arrangement here. So the first one would be bilangan 1 tahun 2016, which is the first cohort lah. And currently we have already finished at the third cohort, and maybe the next is on 18th of March, and this will be continue. The arrangement is like this because currently we have two arrangement, which is the first contract and also the second contract. So for the first contract, we can offer them backdated after they completed their housemanship. So after completed housemanship or after they get fully registered. Yeah. And for the second contract, we cannot give based on the first contract because we have that second contract is actually different contract. So we can only offer at the first day of the second contract only.
Okay, just to recap. So basically there are two contracts. The first contract for contract medical officers, total of 5 years. The first contract is 3 years and the second contract is 2 years.
That's true.
So if you're still within the first contract and completed your housemanship and registered in service, you get the 43 during this 3-year period, then it will be backdated to your first day of medical officership. But if you are already on the second contract, then it will only be backdated to the first day of
the second
beginning of the
contract. Yeah, true.
Yeah. Thank you.
Yeah, right.
Yeah, thank you, Mr. Zainal, for the clear explanation. Now, the
Yeah.
next question. What are the criteria to be eligible for a permanent post?
Okay, this one I think Cik Shaman can answer this. Quite lengthy, yeah. I give the chances to Cik Shaman. Thank you.
Okay, thank you, moderator Dr. Hari and Dr. Sentil. Is it clear?
Loud and clear.
Yes.
Okey, berkenaan soalan kriteria pelantikan pegawai perubatan kontrak kelantikan tetap, basically kita ada dua kriteria umum, iaitu kriteria umum dan juga kriteria teknikal. So basically kriteria umum ni lebih kepada syarat-syarat yang telah ditetapkan dalam skim perkhidmatan pegawai perubatan dan juga tertakluk kepada kekosongan jawatan. So basically syarat-syarat ini pegawai basically dah penuhi semasa pegawai dilantik secara kontrak. Tapi untuk dilantik secara tetap, mereka masih perlu memenuhi syarat-syarat ini untuk dibawa kepada pertimbangan Suruhanjaya Perkhidmatan Awam sebagai pihak berkuasa melantik lah. Itu berkenaan dengan kriteria umum. Selain daripada itu ada juga kriteria teknikal. Kriteria teknikal ni basically terbahagi pada dua pula macam yang ada dalam slide, iaitu kriteria perundangan dan juga kriteria kompetisi. Perundangan lebih kepada dapat full registration daripada Majlis Perubatan Malaysia, fitness to practice dan juga tiada isu tata etika oleh majlis. Dari segi kriteria kompetisi pula dibahagi kepada dua, iaitu laporan nilaian prestasi tahunan dan juga CCHT lah, purata bagi 6 CCP di setiap posting. So basically kebanyakan pegawai-pegawai perubatan kita layak untuk diberi ke pelantikan tetap. Basically generally ramai yang layak, cuma isunya lebih kepada kekosongan jawatan tetap. Itu je tau.
Okey, Encik Shaman, sebab ramai juga yang pegawai perubatan kontrak yang juga menanyakan kalau mereka telah menduduki peperiksaan eksternal sebagai katakan MRCP dengan MRCS, will this give them an advantage over their colleagues? Dari segi kriteria kompetensi, is that a criteria to give them an advantage over their other colleagues to get a permanent post?
Buat masa sekarang di peringkat jawatan kuasa pelantikan tetap lebih kepada isu kekosongan jawatan. Basically ramai yang mohon, ramai yang layak, termasuk ada juga yang telah lulus first part 1, part 2 semua, but still jawatan tetap itu yang agak terhad. So basically pada masa ini kita lebih fokus kepada mereka yang telah layak teknikal dan juga syarat umum dululah.
Okey. Dan juga dinyatakan mengenai susunan ataupun ranking. So adakah ranking ini akan di-reveal ataupun diberitahu pada semua pegawai perubatan kontrak ni?
Berkenaan dengan ranking pegawai-pegawai ini, basically kita memang ada jawatan kuasa tetapkan ranking mereka, tapi dari secara umumnya walaupun mereka itu dirankingkan, kalau mereka layak untuk diberi lantikan tetap, kementerian memang berhajat untuk melantik tetap mereka. Maknanya di sini kalau mereka itu lepas semua syarat umum dan juga syarat teknikal dan ada jawatan kosong, mereka walaupun mereka ada di ranking yang terbawah, tapi mereka kita kumpulkan sebagai layak untuk terima lantikan tetap.
Okay. Thanks for the clear explanation. So at least sekarang pegawai perubatan kontrak kita dapat tahu apa yang syarat-syarat kriteria umum dengan juga kriteria kompetensi, kriteria teknikal yang mereka perlu achieve sebelum mereka dilantik sebagai pegawai perubatan tetap.
Dr. Senti, Dr. Hari, the issue is the pertinent issue is about the vacant post. So currently because of the numbers, the overwhelming the numbers of the medical doctors, that I think they can be considered as a permanent. But the issue is about the vacant posts. So if we have more vacant posts in the future, then we can straightly offer them. So based on as mentioned by the minister just now, the numbers of the posts that we receive from the central agency is about 10,675 overall schemes. But exactly the numbers of medical doctors is about 997. I can't remember the dentist, the total post of dental officer. But currently, the overall numbers of medical officer is about 997. So that one is not issued at one time because we have to consider based on the facility that operate in the future within this year and last year and this year. So basically, the numbers is received in phases. So based on that, we only can consider based on the numbers that we receive from the central agency. So currently, based on 997 and also based on also the attrition in a year. For example, for last year, if the attrition is about 1,000, and actually we can consider about some of it for medical officer and some for the specialists that come up from the training.
Now, this attrition we're talking about, those who are resigning in service or those who are retiring in service, is that what the attrition?
All kind of attrition based on their besar wajib and also based on the letak jawatan and so on.
Okay, we have another question here. Okay, saya menerima beasiswa JPA untuk pengajian sarjana muda undergraduate studies yang terikat kepada kerajaan selama 10 tahun. Kini saya dalam pelantikan kontrak dan kontrak yang diterima adalah selama 5 tahun. Katakan saya tidak menerima pelanjutan kontrak selepas 5 tahun ini. Adakah saya perlu membayar balik kerajaan untuk beasiswa JPA yang telah saya terima dulu? This is the question that has been put forward.
Yeah, this one can I ask BPL to help me to answer this?
Sure, let me bring BPL team on board.
Yeah, Cik Samsul, if Cik Samsul is there? Or Cik Akbal can help us in this answering this question.
Okay. Boleh kepada BPL.
Yes,
untuk pegawai perubatan yang ada kontrak dengan JPA dan sedang berkhidmat dengan KKM di bawah jawatan kontrak, saya mohon pegawai-pegawai berkenaan untuk menghubungi JPA bahagian modal insan BMI untuk mendapatkan penjelasan yang lebih lanjut. Kerana kontrak ini adalah bersama dengan JPA, ya. So anybody who has a contract with the government, with JPA, please refer to the previous contract to get the latest informations.
Okay. So you need to contact bahagian pembangunan modal insan JPA.
Bahagian modal insan.
Bahagian modal insan JPA.
Yes, correct.
All right. So MMA will gather the information on how to contact them and give it out to our members later. So maybe we'll move on to the next question.
Now, the next question is, if I completed my specialist training overseas and intend to return to Malaysia, will the Ministry of Health offer me a permanent position as a specialist?
Yeah.
So this one actually for for medical doctors that train medical specialists in overseas. So if they return to Malaysia, so maybe maybe under the returning expert program under Talent Corps, for example. So actually they have to register to with National Specialist Register, NSR. So basically for registering with NSR, they have to comply with a certain requirement. So for them to be appointed in MOH, I think we consider as a case-to-case basis lah. And also we try to appoint that officers that has undergone and also considered as specialists, so that and focus also on a critical area, so that they can give their services in the KKM lah. So basically, for time being, we are not able to appoint any medical officers that are not considered as a specialist, and so that because of the limited slots in terms of specialists in KKM. So we try to consider specialists only to be appointed in the KKM for time being.
So just to reiterate that, so if you're specialists who are trained overseas, they have to first meet the requirement by NSR.
Yeah, they can return to Malaysia, and first they have to register to with NSR. So they can also work with private sectors, and if they consider to work in a public service, they have to be specialists first.
Okay, and for public service, for a permanent position, there has to be a spot or a vacancy available for them.
They also consider based on the vacancy of post.
Vacancy. All right, thank you.
Okay, moving on. I intend to pursue my career in Ministry of Higher Education. Is it possible while still working under Ministry of Health, or do I need to resign from Ministry of Health?
Okay, there are two arrangements here. For the first one is the officer can be seconded to university, for example, the first one. And the second one, they can make a decision whether they want to stay or they want to leave for the university to work with the university. So for them to work to university, they have to actually letak jawatan lah. They have to fulfill the requirement of letak jawatan first lah.
Okay.
So there are two arrangements here.
Okay, thank you. That was quite clear. Next, we will move on to questions pertaining to bahagian pengurusan latihan and bahagian perkembangan perubatan. So let us just get our panel of speakers on board. Just give us a moment. Thank you, bahagian sumber manusia.
So this will be pertaining to bahagian pengurusan latihan. So the question is the MEDEX examination a prerequisite to apply for master's training program?
Okay. Yep. Okay. For the MEDEX exam, it's not under the preview of bahagian pengurusan latihan KKM. It is a syarat yang ditetapkan oleh IPTA sendiri. So every candidate must pass this exam by MEDEX, which is under the preview of Majlis Peperiksaan Malaysia. Of all that, 17 out of the 23 courses, they need special approval from MEDEX. So for any candidates that want to enter or to take the examinations, please look at the MPM or Majlis Peperiksaan Malaysia website.
Thank you. And my apologies, I forgot to introduce our
that's okay.
from bahagian pengurusan latihan dan bahagian perkembangan perubatan. So we have with us here today from bahagian pengurusan latihan, Tuan Samsul bin Dola, Setiausaha Bahagian, Grade Jusa C. And we also have with us from bahagian perkembangan perubatan, the Timbalan Pengarah of bahagian perkembangan perubatan, Dr. Sharum binti Ismail, Grade Uni 54. She is under the Cawangan Pembangunan Profession Perubatan. So we will just carry on with the rest of the questions.
Yeah.
Okay. Are contract medical officers allowed to undergo specialist training? Most parallel pathway programs require 4 years of medical officership to complete the training. However, under the current contract system, I can only do a maximum of 3 years of medical officer training. Is there any way that I can apply for an extension in order for me to complete my parallel pathway specialist training?
Sebab kita jawapan kita lebih kepada permanent staff saja.
Would you like to address this question?
Should I?
Yes, Dr. Sharum.
Yes.
Okay. Okay, good afternoon and Assalamualaikum to all. Actually, thanks Dr. Senthil and Dr. Hari. Actually, when you enter the parallel, if you use your own money, you can go in. But the 2 years contract for khidmat wajib, you are unable to continue further in the exam. Therefore, we really request the government will give extension of the contract. So far, this medical officer, contract medical officer, allowed to take a parallel. I just add another one, the last, the para 3, that one. Actually, for parallel to do a cardiothoracics, to do forensics, to do the oncology, same time with the urology, if you go straight parallel, you just probably consume 6 to 7 years. But if you go through master, probably will take you 10 years. Because after the master, you have to gazette. After gazette, you have to wait your gazettement period. Then you can enter the sub. The sub plus the master already 10 years. But for these 4, actually the parallel already on the way. Already can go. These 4 also BPL, bahagian pengurusan latihan, they give the HLP for this. But very difficult for the contract officer to join this parallel program because they cannot get the scholarship and cuti belajar bergaji penuh. Only that.
Thank you, Dr. Sharum. I think for the Malaysian Medical Association, we also hope that sooner or later, somehow these contract medical officers will be given some form of avenues to complete their specialist training. And let's move on to the next question. Hari?
For hospital administrators, what are my options for postgraduate training besides MPH, hospital administration, and OSH?
Okay. How is it? BPL answer first or me?
I think Dr. Sharum, I think you can carry on.
Okay.
Or if BPL.
Okay. If look to the list, master in hospital admin, the 3 university that give you a certificate is recognized by us. Then these people, they come back, they were put in position of Timbalan Pengarah as well as Pengarah Hospital. They probably able to receive allowance Pengarah lah, that one. But other public health public health, you need to do a gazettement in the Kesihatan Awam. Clinical research is one of the expert yang you go and learn, but it is not a specialist, to be a specialist. But you can work in the research center, in the IPK or IHM there. Medical law, so many of them go to medical law. We also recognize them, but they only work in the area of amalan, in the CCAPs, only that area lah. But they also important when they want to be a pengarah hospital. What I mean is hospital leaders.
Okay, and another question would be, it was mentioned in the media that contract medical officers may be given the opportunity to train in the UK. Can you please elaborate on this?
Pardon, Dr.
I think there was also mentioned in the media recently that contract medical officers may be given an opportunity to train in the UK under a memorandum of understanding. Is there any information that you can provide us on this?
Dengan BSM. Kita tak tahu.
In UK, you mean?
Yes, in UK.
In UK. Okay. I do it a discussion with the bahagian dasar. Actually, what UK actually want, they need more our specialists, more our nursing, and more allied health professional. I asking also them whether they can train our MO junior. When they go there, the answer is they say yes. Now, what we're doing now, we preparing the MOU with them. We try to nego whether our side of medical people can go to the UK, can get trained there. Hopefully.
Yeah, hopefully you get more information on this later once the MOU is signed. So at least it provides an avenue for our doctors to actually pursue training, and hopefully they'll come back to Malaysia to serve us as specialists later on.
Yeah.
Okay. Moving on. Thank you to the team from Bahagian Pengurusan Latihan and Bahagian Perkembangan Perubatan for that informative rapid question answer session that we just had. Okay. Moving on, we have with us a consultant psychiatrist who will be addressing questions on mental health issues today. So she is none other than the evergreen Dr. Gayatri Kumarasuriya. She's a psychiatrist currently practicing in Hospital Malacca. She's also a clinical hypnotherapist. She obtained a postgraduate membership of the Royal College of Psychiatrists from UK and has the distinction of being the first locally trained psychiatrist to have passed the membership examination. She is now part of the Psychiatrist Postgraduate Training Committee under the Ministry of Health, and as well as the National Curriculum Committee for the Postgraduate Training Program in Malaysia. Dr. Gayatri is a member of the Preliminary Investigative Committee under the Malaysian Medical Council and has written the part on the doctors treating the LGBTIQ community under ethical implications of doctors in conflict situations under the medical ethics chapter. She is a part of MMA Malacca Committee. She is part of the initial team of the Health Doc Task Force. She was one of the panelists in the Junior Doctors Network for MMA and was helped to structure the questionnaire for bullying against doctor. So we have with us today Dr. Gayatri.
Hello.
Hi,
Hello, Senthil. Hello, Hari. Thank you for having me, and good afternoon, everyone.
I'll ask. Okay, Dr. Gayatri, we have a few questions lined up for you. And the first one being, I have been a victim of bullying or workplace harassment by my senior doctors, but I dare not voice out due to fear of extension or repercussions. I've been suffering in silence. How do I seek help?
All right. Thank you for that question, Hari. Perhaps what I'd like to start off with is to quickly just define what bullying is. Bullying is basically persistent, offensive, abusive, and intimidating, malicious behavior or an abuse of power which makes the target feel upset, threatened, humiliated, vulnerable. And it undermines the target's self-confidence and makes them to suffer stress. So there are various types of bullying, as we all know: the physical, the verbal, the social, the cyberbullying, and so on. Now, not to get confused about harassment, because it gets often interchanged. So I just want to hear the definition here. Harassment is also a form of bullying, but however, here the target is selected on a specific class. Could be the gender, the ethnicity, religion, color, disability, or so on. Okay, so sexual harassment falls under that umbrella. Now, we talk about the behaviors of the perpetrators in bullying. This is said to be a repetitive and persistent behavior with the intention to undermine or to cause distress to the target. However, a single incident can also be constituted as harassment or bullying if it is severe enough and it causes significant and lasting impact, on the target. Now, it's also important for us to know what is not bullying. All right. So just to clarify that very briefly, what's not bullying is, when you are admonished at work, which we all, went through that, when you're being disciplined and, sometimes your head or your supervisor tells you something, tells you off because of your work. Okay. And if they're acting reasonably, then, that's not constitute. Of course, a senior can check you if your performance is poor. They can take disciplinary action as long as it's done in a reasonable manner. Yeah. So differences of opinion is not bullying, right? So the same goes with harassment. Sometimes, there are dress codes, and if we do not follow or abide by the dress codes, our seniors or our supervisors have the obligation to correct us and say, what, Gayatri, your dress is a bit too short. I'm using myself as an example. Yeah. So, Gayatri, your dress is too short, or, maybe you need to not wear this anymore. That's, if it goes according to the regulations, and if it's told in a reasonable, appropriate manner, perhaps something like this should be told, without witnesses, so that people, you don't feel embarrassed. So these are not harassment. Yeah. But the end of the day is there are regulations and which are put in place, but unfortunately, we do not utilize them. Yeah. If we look at the Malaysian Medical Council, under the Good Medical Practice Guideline that was updated on the 18th of June 2019, there are 10 golden rules of medical practice. Now, I'm not going to run through this. You can check them off the MMC web. But golden rule number 8, amongst the other criteria, is what is written there is to avoid abuse of power, right? So a bully basically abuses his power. Yeah. So remember that. Now, in that same Good Medical Practice Guideline, there is a section. There are many sections. Section 6 talks about the doctor as a team player. Now I'm just going to zoom to subsection 6.3, yeah, which says that a doctor who is senior in service, must accept the responsibility and always be available to train his junior colleagues, including house officers, with understanding, patience, and tolerance. Easier said than done, because sometimes, doctors are also human beings, your seniors are also human beings. Some of us are seniors, sometimes even I lose my patience, but the respect, this is what I want to maintain. You may lose your, patience or tolerance sometimes because you are bogged down with work, and then, they keep coming and bugging you. They're not bugging, they're just coming to clarify. But the respect must always be maintained. You can raise your tone, but always respect the other person. So when that's eroded, then I think a lot of damage happens, yeah? So when any behavior which may be considered bullying, harassing, or distressing to a junior colleague is totally unacceptable. And that's written in the Good Medical Practice. So this is something that everyone, seniors and juniors alike, must be aware. Of course, we have loads of regulations, laws. I'm not a lawyer, nor do I have the intention of pursuing law. But the thing that we need to remember is that, as interesting as it is that there are many laws and regulations. For example, the Penal Code, the Employment Act 1955, the Minor Offences Act, Civil Law Act, Defamation Act, and also remember our General Order, which in it has the Peraturan Pegawai Awam 1933 under Kelakuan and Tata Tertib. Occupational and Safety came up with the Act in 1994, and so did the Communications and Multimedia Act, which came out in 1998. Now, these are acts that you can look into and see how you can, strengthen your case. Yeah. Now I'm going to go straight to how to channel the complaints. Yeah. Now, there are various channels that you can use. Yeah, the thing is whether you want to use them or you have the courage to go forward, because if not, these channels are wasted. Yeah. So you have the most easiest way is to go through your hospital. I will elaborate in a while. Then if you feel that you've gone through the hospital, but your hospital is not, working on it for some reason or the other, though every hospital, I know that topmost from your pengarah and, all those who are responsible, they take this very, very seriously. We talk about zero tolerance to harassment, kekerasan terhadap anggota KKM, whether it's external or whether it's internal. But for some reason, if you feel that your hospital is not taking you seriously, you can go directly to the Ministry of Health. Then there is always MMA Help Doc, which we established years ago, which is terribly underutilized. For what reason, we do not know why. All right, so we hope that after today, you will remember that MMA has a help doc and we are all here to help you. All right, now, how do you report a bully? Now, any behavior of any other that makes you feel uncomfortable must be dealt with, but deal with it constructively. Yeah, don't ever assume that you deserve to be treated that way. But at the same time, don't assume that that behavior is a form of bullying. Okay, let's look at it objectively. Now, the first time it happens, document that incident. Now, we doctors are really, really very poor with documentation, which is why most of our issues, fall short halfway, because documentation is not one of our strengths. Make it your strength, right? Document the incident. What happened before that? What was the predisposing factor that led to this, altercation? The date it happened, the time it happened, what were the words used? Do you have witnesses? Get down their names. If it happened in front of a few patients, get down your patients' names as well, And then discuss this with someone you trust. Of course, you will confide in someone who is your peer, But being juniors sometimes, but this is not to say that only juniors get bullied, even seniors get bullied too. Okay, but talk to somebody who is more senior, someone whom you trust, someone whom you feel safe with. And though, like I said, we do not condone such behaviors or abusive words, because respect must always, always be maintained. Sometimes the other person, it may be a one-off incident where the other person may be having a bad day and, you're supposed to do something that is urgent for the sake of the patient. You didn't do it and, you got a shelling because of that. So you too need to have that insight. Now, use this, if that is the case, if it's a one-off thing and this senior has always been nice, but use this incident to motivate you and help you move forward. For house officers, please make sure you read and understand your guidebook for the house officers by the MMC, especially on chapter 4, which talks about work and conduct, medical record, and also your dress code, and also chapter 6, very important, how to look after yourself. Okay, now let's say this happens again and again, especially on a daily basis. You've done all your, whatever you're supposed to, but you still get picked on. Yeah, remember that journal I told you to keep at it. Document, because you need proof, and that's really, really important. recordings. If you need to record. If this person is really verbally abusive, uses 4-letter words on you, record it, video. I mean, you can't get a friend to do it for you. Get your witnesses, document what was the cause, what were the words used, and so on. Gather witnesses whom you know will be, willing to step forward and won't chicken out towards the end. If you know that there were other targets who went through the same form of bullying, but they are in different postings, who are scared to work on their own, maybe you can gather them together and go as a group, all right? Make a formal complaint with all your evidences. First, go to the person you trust the most and feel safe with. With that person, maybe you want to go to your pengarah and then channel this to your pengarah. They're supportive, and sumber manusia will come in. You may be advised to make a police report depending on the nature and the intensity of the of the offense. If it is sexual harassment, you must do a police report. You must do a police report if it's sexual harassment. If the bullying is intense and causes you a lot of distress, it is your right to make a police report. Okay, so we're not going to take that away from you. That is your right. Okay. You may be asked, and you will be asked, to see a psychologist or a psychiatrist to assess your mental distress. Now, this does not mean that you have mental illness. Remember that. This is just to assess your mental distress, and later the report from the psychologist or the psychiatrist will be helpful to you to strengthen your case, right? Now, a mistake a lot of people do is that they make the police report and then they think MMC will work on it. You need to file a separate complaint to MMC, all right? Possible, get your witnesses as well, because there is a form in MMC which will ask you about witnesses in the complaint form. So like I said, get witnesses whom you know won't run away. Preliminary, so this will go to the PIC, which is a preliminary investigating committee. And they will do the investigations, and if they find that there is sufficient grounds, they will forward this complaint to the disciplinary board, the disciplinary committee, who will investigate further and then decide on the outcome in terms of the practice, whether to suspend or terminate. Okay, now basically I think that's it in terms. I hope that was helpful.
Very comprehensive. Thank you, Dr. Gayatri. In the meantime, our viewers, please also log into ahaslides.com and also answer a few questions. There's a question on, have you experienced workplace bullying or harassment? Let's look at our feedback from our viewers. So as the talk is going on, please answer the questions on our slides. Sandil, shall we move on to the next question?
Yep. So while we wait,
I just want to say this one thing which is really important. Remember that bullies are cowards. They have low self-esteem. There's something about you in particular that triggers them and make them want to react. So there's something positive in you that makes them want to react. So remember that. It's about them. It's the way they handle. So your psychiatrist or psychologist will guide you on how to become more resilient. But tips is always be around people who are supportive. Don't be alone, and walk with your head held up high.
Right, as the famous saying goes, be positive and stay COVID negative.
Yeah.
So let's move on to the next question. Will a diagnosis of a mental health disorder carry stigma and preclude me from promotions and training opportunities?
Okay. All right. So mental health illness, unfortunately, worldwide, universally, carries a stigma. Yeah. There's no hiding behind that. As much as all of us try to combat that, and we talk about zero stigma, it's not going to happen, not for a very long time, but it is reducing. Unfortunately, the bare facts, the truth is, it's happening even within our fraternity, the medical fraternity. However, let's break it down. In temporary mental health issues, you see, the thing is education. How you educate the people around you, how we educate the people around us, right? Now, in terms of promotions, and I believe you said training as well, Senthil, yeah? So maybe I will talk about the promotions first. See, just because somebody has a mental health illness, it does not mean that the person cannot function. There are different degrees of mental health illness. You could have suffered for depression for a short while because you had a stressor, and after which you've been okay and you've been off medications, and you're able to move forward and you're fine. So if you're able to function properly and if you're able to perform and you get good reports, there is nothing to stop you from getting your promotions if it's due to you. Likewise, the same goes for training. If it is a thing of the past and you suffered one form of illness, it's just like you fell down and you fractured your leg. You're not going to keep fracturing your leg all the time. So it could have been a stressor that caused you to be depressed. You've overcome it. You know how to handle yourself, and you've been off medications and you're fine for years. So I don't think that stigma is there. I mean, you will be stopped from doing your training. In terms of serious mental illnesses like psychotic illnesses like schizophrenia, for example, that we would be a bit more cautious, because we need to look at the severity of it, because it's not only about you, it's also about the patients that you are going to see, because you want to do your training to be a postgraduate. Your how is your clinical acumen, how is your judgment, your cognitive function. Now even for that, we have those who are seen to be medically impaired for some reason or the other. They will go through the MMC, they will go through the medical review panel, which is known as the MRP, and also through the Fitness to Practice Committee. Now, impaired medical practitioners are basically those who are unable to fulfill their professional responsibilities, and as a result, unable to practice with reasonable skill and safety. Okay, so these may be, and it's not necessarily only those with mental illness, even those with physical illness. Okay, so I hope that kind of answers the question.
Very clear, Dr. Gayatri. In the meantime, while we were talking, or you were explaining to us, in the background, we're actually conducting a poll. Have you experienced workplace bullying and harassment? And surprisingly, about 57% of our viewers today, yes, they have experienced workplace bullying or harassment. Let me show you that on screen. 57%. And looking at the demographics of our doctors, a majority of doctors are actually in the younger age group of medical officers, house officers, medical students. Right, now moving on.
Wow.
That's an interesting question. But in the interest of time, maybe briefly you can just tell us, if I'm an ex-COVID patient who recently contracted the disease and currently back to work. However, there is a social stigma towards me amidst my colleagues. How do I cope with this?
All right, this is really sad. We go around telling everybody not to stigmatize, and we are facing stigma on our own within our own fraternity. All right, basically people stigmatize because in terms of COVID, it's a new disease. It is unknown. It's never been here before. The fear of the unknown, and that association of that fear with that particular person. Now the thing is, what you need to do is, this person who has been socially stigmatized, is you need to communicate what you're feeling with your colleagues. That's something we lack as Asians. We don't like to express what we feel. We express it in different ways. Open up and talk. It's okay. What's the worst that can happen? They won't entertain you, but at least you tried. Talk to them. Tell them what you're feeling, and it also probably helps to look at their perspective as well. Perhaps they have aged elderly parents at home. Perhaps they have, children at home. They may have their fears. So talk to them. Now, the thing is, the virus does not discriminate, so neither should we. So what you can do on your part, this person, is that have your facts and encourage your colleagues and your staff who's working with you to understand those facts. Guide them about the facts. Go to the proper websites, WHO, MOH, UNICEF, and so on and so forth. And do not spread or forward information which is not official. I've actually stopped reading all these. Anything on COVID, I stopped. It's very stressful, so I just stop. You know, whatever the Ministry of Health tells me, I listen to that and I tell it out. Okay. Other than that, I don't read. Yeah. If not, I'll be
All right.
confined to the house too.
No, thank you so much, Dr. Gayatri, for the mind-opening
welcome.
discussion. All right, for the mental
most
health
welcome.
issues and workplace bullying and harassment among healthcare workers is often a neglected topic, and we hope you can identify the red flag signs and seek early help. Now, we will be compiling questions from the live Q&A session, so please keep them coming. You can submit your questions to the AHA Slides link that is shown on the bottom of the screen. Now, let me just show you the link. And you can scan the QR code in the top right corner as well. You can also have a look at the questions posted by others and like them. The more popular questions will be moved up the list and will be prioritized. Now, I would like to introduce our next speaker, Dr. Sivabala Salvaratnam, Honorary Assistant Secretary from SCHOMOS Exco, to speak to us about application for MMA membership and the special promotions that we are running. Application for MMA membership and the special promotions that we are running. Dr. Siva?
Hi, Hari.
Dr.
Hi, Sindil.
Dr. Siva?
Hello.
Hi.
Can you hear me?
Yes. There's a bit of a connectivity issue here, I feel.
Yes.
Lines
There's a bit of a
lacking.
connectivity
issue here, I feel. Lines lacking.
Okay. We are live and direct from Penang. You guys are doing an excellent job in Sabah. I'm just concerned whether the line is clear and, you know, how's the audio and the visual?
I can hear you. There's a slight lag, but I can still hear you.
I can hear you.
There's a slight lag, but I can still hear you loud and clear.
All right. So, when you're polling the guys on the show that you guys are doing great job, what seems to be the question? Is there an issue with people taking up membership, or is everyone coming on board and signing up to become Malaysian Medical Association members?
Now, Dr. Siva, the common question now is why join the Malaysian Medical Association when there are so many other associations representing doctors?
Okay, thanks for the question, Hari. A loaded question indeed. And I'll first state the disclaimer, okay, which is I am a life member of the MMA. I am also a life member of the Obstetric and Gynae Society of Malaysia. So no disrespect to all medical associations out there representing Malaysian doctors. Each and every one of them have got a role. But what sets the Malaysian Medical Association apart is that everybody is welcome to join, meaning whether you're a house officer, medical officer, specialist, government, private, you know, contract doctor, permanent doctor, it doesn't matter. There is a place for you within the Malaysian Medical Association. There is no gender bias. We just heard Dr. Gayatri speak about sexual harassment. There's no bias here in the MMA, whether it's gender, religious, political bias. You can be a member of any political party. You are, as long as you're a Malaysian doctor, you are welcome to the MMA. So we embrace all and we invite everyone to join the association. Now, moving on to why the question that you asked, right? Junior doctors are contemplating why join the MMA. By and large, you can look at it from three different perspectives. Traditionally, back in the day when I was a house officer, the common answer I used to get to that question is all nurses are members of the nursing union, all teachers are members of the NUTP, National Union of Teaching Profession, and all practicing lawyers are members of the Bar Council. So why aren't all doctors members of the Malaysian Medical Association? That was back then. My favorite perspective as to why one should become a member of the MMA would be the historical perspective. I don't think many are aware that the MMA was formed in 1959. That's just 2 years after our independence, which makes the MMA the youngest sibling of Malaysia. Okay, so the association has been around. A lot of our founding members were eminent doctors. Back in 1975, 70% of all Malaysian doctors were members of the MMA, right? So there's a fantastic Malay saying, tak kenal maka tak cinta. So I invite all doctors to come and get to know the MMA and the work that we do. And that isn't difficult, because if you log on, if you get on to our website, mma.org.my, the e-burrito that's there in our archives will tell you the rich history and tradition and the work that goes on within the MMA. And our Honorable Health Minister rightfully pointed out that thanks to MMA SCHOMOS, we are having this very fruitful discussion today. And for non-members out there who are not aware, the Malaysian Medical Association is the only organization to have 2 representatives at the national level in MBK, Majlis Bersama Kebangsaan. All right. And it is at this place where all policy matters are implemented. We carry, SCHOMOS brings it up to MBK, and we carry out policy matters. For example, that videos that you all were screening earlier, close to 30 years ago, our MOs nowadays may not believe that doctors were doing on-calls free of charge. Thanks to MMA SCHOMOS, we got the on-call allowance. Back in 2004, that's about 15, 17 years ago, the critical allowance, another achievement by MMA SCHOMOS. So a lot of work is being done, but the young ones are not aware. So now the third and final perspective on why you should become a member. In the words of the millennials, what is in it for me? Okay, get on to the website. It's all there. At least 21 benefits await you when you sign up, right? For a mere 150 ringgit per year, annual membership fee. And when you become an MO and you sign up for life membership fee, 1,500 ringgit within the first 2 years of MO-ship. And we do not wish to burden your pockets. Okay, you can break it up to 150 ringgit payment over 10 months. And after 2 years of MO-ship, right, it's 2,500 ringgit for life membership. You need to be a member in benefit. I have yet in all my years of being an MMA member, and I'm proud to say I'm wearing an MMA t-shirt right there, okay? In all my years of being an MMA member, I have yet to meet somebody who has come and told me, I've wasted my money signing up to become an MMA member, okay? And today, it is really sad to note that our young doctors do not have a guarantee as far as their career pathway is concerned. Back in the day, we are all permanent doctors within KKM. Today, the young ones are contract doctors. So there is no job certainty. Nobody knows what's going to happen for sure after 2 years of being an MO, right? If somebody were to ask the young doctors, what are you planning to do after, in terms of specialization? And your answer might be, boss, I don't even know whether after 2 years I got a job. How can I specialize, right? And if you do a Google search, right, the only organization that has been championing the cause of the contract doctors every other week in mainstream media, whether whether it's Malaysia Kini, Free Malaysia Today, Code Blue, okay, or even the Star newspaper, all major news portals, the only organization championing the plight of the contract doctors I am proud to say, is the Malaysian Medical Association. Now, if all of us do not take up membership and make the association stronger, it's going to be a very muted voice, right? We have the attention of the good health minister. We have the attention of JPA. We have the attention of Talent Corp. All stakeholders, government agencies are in this together, right? So,
Okay, Dr. Siva.
let us move forward with a united voice, sign up, become MMA members, and tell us what more we can do for you.
Now that
Have
that
I
was a
missed anything,
great
Hari?
sales- No, I think you have covered all the bases. Dr. Siva, that was a great sales pitch.
Hello?
Now, I would also like to now just poll our audience and let's have a look at some of our audience today are members. Maybe you can
Yes,
just
Hari?
go on to our just go on to our at our
I think you've covered all the bases. Your audience and let's have a look at our audience today are members.
Okay.
Maybe at our
Sorry. I didn't get the question.
no, Dr. Siva, we're
Hello?
just taking a quick poll to have a look at how
No,
many
Dr.
of our
Siva, just take a
viewers
quick
are
poll
MMA
to have a look
members.
at how many of our viewers are MMA members.
Okay.
Okay, so far there's about 75%. Oh, the numbers are changing. So let's have a look. Only 35 audience have actually polled so far. So maybe give them a few seconds. Let the poll results come in.
Looks like many have left the AHA Slides platform. Okay, maybe it's time to come back in because after this we'll be having the question and answer session. And please key in your questions or like the popular questions so that we can address them after this. So come on everybody, get back onto the AHA Slides platform and probably join this poll as well.
Okay, Dr. Siva. So at least about 1/3 of our audience are non-members. Now let's have a look. Amongst the non-members, will you be signing up for MMA? Now, Dr. Siva, let's see whether your sales pitch worked. So far, so good. You've been doing a good job. Dr. Siva, I think you're still muted. Could you unmute yourself?
Members does not make, okay, whether all doctors
Dr. Siva, I think you're still muted. Could you
Can you hear me?
Yes, we can.
Can you hear me? Hello?
Yes, we can.
Okay. Now I'll tell you something the old-fashioned way, lah. All right. Whether or not doctors join the MMA is not going to make a difference to me, Dr. Sindel, or Dr. Hari. We do not have shares or we are not stakeholders in the MMA. Having said that, if the MMA is not well represented by a good number of doctors, I really pity the contract medical officers because you lose a platform. You lose a platform and a voice to be heard. Hello?
Okay, thank you, Dr. Siva. So
Okay, thank you, Dr. Siva. So
that was a passionate
you,
plea
guys.
to our
Thank
audience
you.
today.
that was
Right,
a
and thank you
passionate
for your
plea to
time.
our audience today. All right, and
I know you are on call today, so despite your busy schedule, you took time off to come and share with our audience about MMA. Thank you.
Have a good call.
Now, the state MMA branches also have their own ways of giving back to the members. Members will always get great discounts for all events, as you can see clearly. And besides, MMA Sabah and MMA Sarawak now also offers RM 100 ringgit cashback for those signing up for new live membership. Do get in touch with your friendly state SCHOMOS chairpersons for more info. You can check out their list of the SCHOMOS reps for your state pinned to the top of our MMA SCHOMOS Facebook page, or you can visit their respective state Facebook or Instagram pages.
Okay, and speaking about events organized by MMA for its members and the public, right? We have another event that's coming up, which is organized by MMA, both for members and non-members. So this is the Malaysian Medical Association's Financial Planning Series. This is a series of webinars on a monthly basis over a period of 6 months. This seminar is basically to provide financial knowledge both to members and non-members in the medical field. We basically feel that as doctors, most of us don't have much financial literacy. Our investment decisions are made based on peer pressure and not based on informed decisions. Therefore, we came up with this program to address this issue. So in this program, we will actually be covering a lot of fields such as not only income protection, like how much of medical insurance to buy, how much of premium should we pay per year? Is it based on our debts? Is it based on our earnings? So those are things that will be covered. Besides that, we will also look at investment opportunities. So how do you objectively invest in properties, right? We will take you through the baby steps, especially for beginners, how to step into the share market and start investments. What are mutual funds? What is unit trusts? So should I invest in private retirement schemes? So these are the topics that we will be covering, and it's really beneficial, especially for us to grow our savings. So for those of you here today, it's a special promotion. As you can see, the 2 promo codes, MSVF member and MSVF non-member, right? These promo codes will only start to take function in a while, and it will only last till 11:59 p.m. tonight, right? So for those of you all who are interested, scan the QR code or go to the website mmafps.com, and you will get all the details about this program on the website, and feel free to sign up on the website as well.
And next, MMA Negeri Sembilan will be organizing a MMA Negeri Sembilan Fight COVID-19 virtual run. Registration has already started and will go on till the 30th of April. Time is running out. So timing of run is on the 7th of April, which is in conjunction with the World Health Day, and ends on the 7th of May. During this time, you can run 5 kilometers or walk 7,500 steps and capture it on your smartphone or Fitbit and send the screenshots to the email address given, which is the MMAofficialevents@gmail.com, to be eligible for lucky draws and e-certs. Those who have paid will receive a drift jersey, medal, and goodie bag. Payment is 61 ringgit for Semenanjung, Malaysia, and 66 ringgit for Sabah and Sarawak, including postages. For more info, please scan the QR code or click on the link and see us on Facebook, MMA Negeri Sembilan, or email MMAofficialevents@gmail.com. Now, before we move on to the live Q&A sessions, let's take a short break and hear from our sponsors. Stay tuned. Soon, we'll be answering some of the questions that you guys have posted on the live Q&A.
I'm a consultant neurologist in a public hospital in Malaysia. The hospital I work in is Hospital Serangkaya, and I have been in practice for the past 20 years. We have discovered some protective effect of vitamin E tocotrienol in regards to the brain. The one study that has already completed has been published in one of our international journal. In this study, we have 80 patients, and these 80 patients, 40 of them, we give them vitamin E, and another 40 of them, we give them placebo. Those people who are on placebo, after 2 years, we can see that there is some brain lesion. The brain lesion in their brain actually increased, because these are the people who has hypertension and diabetes. They are high risk of having brain lesions. So if they were given placebo, at the end of 2 years, there will be increase of brain lesions. However, the other group who is on vitamin E tocotrienol, after 2 years of research, the brain lesion actually is the same. There's no increase, and some of them actually show some negative result, which show that it is protective.
benefits of palm tocotrienol, as you see in the literature, are many. And in the beginning, it all starts with a little bit of a hint of research, and then some research progresses from animals to people and then to clinical trials. So based on my direct experience, we see that tocotrienol is very helpful for neuroprotection, or it's good for your nerves and your brain. And especially as we age, neurological function goes down. It's very well known. So I would expect that as a function of aging, tocotrienol would be very helpful for your central nervous system. So we have reported that as it relates to protecting nerves from a variety of toxins, tocotrienol is at least 100 to 1,000-fold more superior than tocopherol. So this is quite striking. Also, we have found that the mechanism by which tocotrienol functions to protect neurons are very different from that utilized by tocopherols. So from that standpoint, tocopherols are extremely potent neuroprotectants. Frankly speaking, as of now, palm tocotrienol is primarily in the food domain, in the diet domain. And as things are progressing, it's very clear that in certain domains such as blood thinning, such as stroke, such as acting against certain neurological functions, tocotrienol is almost elevating to the level of medicine. So I see that going forward, tocotrienol enriched food products will be in the market and will have the room to serve as so-called preventive and wellness agents that would help perhaps in healthy aging. But as it relates to rescuing from a certain disease process, I think in 10 years from now, I expect tocotrienol to be in the market also as medication. Of course, the formulation for medication will be different from that of food, but in the areas of neurological function, in the areas of liver function, in the areas of skin function, we are seeing some very extraordinary new results that show a very beneficial effect of tocotrienol on skin stem cells. So that would have to do with cosmeceutical applications. So I think we are standing at the corner of this transition phase where much of tocotrienol will be in the food domain, but gradually, certainly in the next 10 years, I expect multiple products to be also coming out on the pharmacy side.
After seeing that video now, I feel like having a nice toasted bread lathered with some tocotrienol-rich margarine made from red palm with a nice hot cup of tea. That would be very nice, wouldn't it?
Oh yeah, it definitely will be. I'm already craving for some.
Okay, we will now proceed to the live Q&A sessions. We have some questions here from the viewers, which has been given to us through the AHA Slides platform, right? So please remember to log on to the AHA Slides if you have any questions and like the questions that you like, so that these questions will be popularized and we can address them. So we will start off with Bahagian Sumber Manusia and the questions related to them. Okay, we have Tom Zainal and his team here. So taking it off, some of the questions here are repeated questions. So probably they will have the same answers. Okay, let me just see. First question. If I'm eligible for permanent post, but by the time my contract ends, then there is still no kekosongan, penempatan or permanent post available. What is the next step and what are my options?
Okay, thank you, Dr. Senti and also Dr. Hari as a moderator. So basically, what we can do right now is not much. As actually, maybe the next step we can do is from time to time we try to apply for more permanent posts. Because right now also we can see that there are certain area or in the hospital, for example, in the ICU ward and so on, we still need more officers actually And of course, this also due to the new or upgrading facilities and also the existing facilities that we still need additional posts. We still receive application or demand from JKN to ensure that we can increase the number of permanent posts in all schemes. So maybe the second one is as mentioned by the YB Menteri Kesihatan just now. Actually, we already discussed with bahagian pembangunan BPL, and we are at the final, I think, stage, and the proposal of maybe we try to ask the government to offer a contract in more in terms of long-term contract, for example. This will be maybe discussed at the higher level in the KKM. So I think we try to look at this to focus at the moment. If the proposal is considered at the MOS, and I think we can table it to the government for consideration. So I also look at the list of the questions. So maybe I can make some arrangement to answer some of it. So basically, one question asked for offers based on merit. So basically, this actually we have already in our mind to consider as a merit as one of the criteria to ensure that maybe the highest maybe in terms of character, capability and capacity, they can consider as permanent. But we also consider some of the reason. Maybe, for example, maybe some of the MO they still need more time to focus at the beginning on the housemanship, and maybe they need time to focus on their interest niche area, and some I think not able to work in the area that in their interest. For example, some place in the rural area and whatnot. So basically, these are the reasons. That is why we not consider some of element of merit. For example, getting part 1 or part 2 as a main criteria for permanent consideration. So and of course, because of the number of vacant posts is limited, and as we know that the big chunk of the graduate is 60% of it is from local university and 40% of it is from overseas. So actually, for local graduate, we do the moratorium within 5 years to ensure that we can control the numbers. But for overseas graduate, we cannot control it. So last time we have some arrangement with Kementerian Pendidikan Tinggi with the implementation of NOC, non-obligation certificate, but it is actually hard to implement it. So I think because of the numbers is overwhelming, and also the placement is very small, limited. So we have to consider right now based on the minimum criteria that we spell out in our guidelines. So basically, the guidelines, all houseman officer can reach it at our portal e-placement, e-houseman. So okay, some of the questions to answer because
maybe one question we can ask is this: when is the next permanent MO intake? How many will be taken? As the last permanent intake was some time ago.
Yeah. Actually, we try to settle the issue of getting extra posts for specialists right now. We have already do our proposal to the Public Service Department to ensure we get some additional posts for specialists, and then after that we can consider for MO to be considered as permanent post. Basically, maybe after we settle it, I think within this half of this year, maybe we can focus on the permanent offers to the MOs. So,
Tuan Zainal, there's also another question here. Contract officers are also unable to claim allowance gangguan. Could this be considered for our cohort as well? From one of the viewers.
Okay, allowance gangguan. So this one I need the assistant from my KPSU, Puan Fazida, if can answer the question.
We'll just bring Puan Fazida in.
Yeah.
Okay.
Dr. Sentil.
Yes.
Ya, Encik Syarman.
Berkenaan dengan allowance gangguan ni, basically memang dari segi allowance gangguan ni hanya layak kepada pegawai lantikan tetap dan tidak dipanjangkan kepada pegawai lantikan kontrak. Cuma dari segi allowance lain seperti allowance perpindahan, contohnya pegawai lantikan kontrak dan pegawai lantikan tetap ni basically layak untuk memohon allowance perpindahan tu. Maksudnya tak ada beza lah. Cuma yang buat masa sekarang ni kerajaan putuskan allowance gangguan hanya untuk lantikan tetap lah.
Okay. And just to clarify a bit further, allowance gangguan ini is for lantikan tetap and it's only if diarahkan berpindah. Kalau minta berpindah, they do not get the allowance gangguan. Is that so?
Betul.
Okay, we have a question next for bahagian pengurusan latihan team. Why can master's program be available for contract doctors? And if the government does not want to offer HLP for masters, why can contract doctors pay for the master's program?
Thank you, Dr. Harry and Dr. Sentil. For this, the terms and conditions for master's programs, the contract workers are not eligible to apply for HLP, for hadiah latihan persekutuan. They are not eligible because the HLP is only for permanent doctors. Yeah, and why can the government offer HLP for contract workers to pay for the master's programs? I think the master's program itself required them to be a full-time students or a full-time study. Yeah, you know. So the program itself, they can afford to, you know, to do their job and then at the same time to do their studies. So I think that's the reasons why they cannot, you know, do the master program by themselves, pay for themselves. Yeah. Okay.
Okay, and regarding doctors, contract doctors who wish to pay for on their own, is that a possibility for them? Is that an option?
Do you want to answer again? But they have to apply for cuti belajar bergaji penuh, and then that's the reason why they can't apply for the HLP.
Okay. I think just to clarify a bit more on the question, I think they're asking if, like a foreign candidate, will they be able to apply for a post in the university for postgraduate training without a monthly pay and without HLP? That means as a day scholar. Is that an option for available? If I'm not mistaken, that is the question that they're asking.
I think that one, Dr. Sharon.
Okay. Okay, Dr. Senthil, Dr. Hari. Actually, when you are contract officer, you're not eligible to get the HLP with the cuti belajar bergaji penuh. Actually, when you can pay for your study, but how are you going to have cuti belajar bergaji penuh? If you cannot get there, means you have to resign from the job now and you join the university. It's very, very difficult for a student resign and need to pay the study their own. That's the important things because they're still junior, they still don't have a lot of money in the account. I don't think they able to resign and go study.
But for those doctors, for them, say finance is not an issue. So there's still an option for them to resign, join the universities on their own accord. That means they pay for the studies themselves without a monthly pay or gaji. And then once they finish their course, can they then consider joining back the ministry as a specialist?
They can join the master program in university. They apply to university as an international student.
Okay.
It's very expensive.
And once they complete, is it an option for them to apply back for a job with
same time also they need to go to the NSR. They approved by NSR, then they we can consider if the post is there.
But the issue will be for gazettement, because in order to be gazetted by Ministry of Health before they can apply for the NSR, so can they then come back and join KKM for the gazettement period?
Normally, when they go out from the Kementerian Kesihatan and they do their master, they do their specialist study, when they want to come back, they need to register NSR first. When they go to NSR, the NSR will advise them where to do their attachment. Okay. They cannot come in to do a gazettement in the Kementerian Kesihatan. If NSR mention, you can do attachment in the hospital A, then they come in, we assist them lah. But that person need to pay lah. Okay. Attachment is very expensive in medical fraternity. You pay 1,000. If surgical, you pay even more lah for 1 month.
Okay. Right.
Let's move on to the next question. Can contract medical officers, UD 43, use hazard leave, like the leave given to the MOs in the psychiatry and the radiology department, radiation leave and mental health leave, as the permanent MOs can use prior to this?
Okay, Dr. Seti, actually the hazard leave, we are in the process of getting approval from the PSD, Public Service Department. So basically right now they are not eligible for that kind of arrangement. Thank you.
Oh, that's great news, Don Zainal. We hope it works out soon for them.
Hopefully JPA approve. Right.
Now the next question will be, will medical officers who have served in Sabah or Sarawak districts have merit points to enter specialist master's program or any parallel pathway programs?
The answer is yes. The university will consider, you from Sabah, you from Sarawak. But the Sabah Sarawak is not in the ranking.
The last question.
They just will consider. You hear me?
Yes, we do. Okay, thank you for that answer. So we're just preparing for the next question. This will probably be the last question for bahagian sumber manusia, bahagian pengurusan latihan, and bahagian pengembangan perubatan. So the question goes, does Kementerian Kesihatan Malaysia consider transferring those chronic MOs in the tertiary setting who've been in the tertiary hospitals for more than 5 years but not progressing to the district hospitals and give the young contract doctors from the district hospital a chance to come to the tertiary hospital for training?
Saya jawab, Kena I answer?
Boleh,
I rasa this issue which currently a bit concerned by our specialists, because after 5 years they stop their working, they need to train again every year they feel so fed up. That's why you ask me whether the chronic MO, but they special trained in the discipline. They can do everything. The only why they cannot go to specialist because their interview they fail 3 times, they go in cannot go, but they're still expert in the discipline. How the specialist, the consultant then allow the senior chronic MO there and transfer to this is difficult to do such way. But people in the admin side, unit quality, the people very often also we transfer them to a district.
Okay. I think one initiative that is coming up, I think, by the WHO is the global access to healthcare. So just thinking about the global access to healthcare, so these MOs are actually trained, just that they don't have the paper qualification. So maybe in future we can look at probably sending these MOs to district to do simple procedures rather than getting these patients to be transferred to the tertiary hospitals, and that will probably improve access to healthcare.
Yeah, Dr. Cynthia, like global surgery, we already done. We sending them to the district hospital in Tanjung Karang, whatever. They do a surgery there because they're well trained in the big hospital.
Okay, that's great.
Already done.
Okay, thank you to our speakers from bahagian pengurusan latihan, perkembangan perubatan as well as sumber manusia for the questions, for answering all the questions that were posed by our viewers. I'd like to now ask questions to Dr. Gayatri. So a few questions for her. But before we start on, can we take a screenshot, just a photograph for all of us? Just 1 second. Let's take a screenshot.
Put on a white smile. Let's take a picture.
Okay, 1, 2, smile. All right. Okay, thank you so much, team from Kementerian Kesihatan Malaysia. I will just remove you from the screen at the moment.
Thank you.
Thank you.
Now, Dr. Gayatri, so we have a question.
Yes.
How to deal with anxiety of job insecurity?
Okay, not an easy question to answer, isn't it? Listening to all what was discussed just now, yeah, well, the anxiety is something that is very normal, I think, for all of us. But I think looking at the reality of the situation, acceptance. Number one is acceptance. Now, I always talk to my juniors, whether they're house officers or medical officers who are in contract. I said, you know what, there is more than just what we see. Yeah? There are other hopes. So you need to start planning your life, because if you just focus on your anxiety and don't plan, then you're going to be in a worse place, right? So if you know that the situation is such and such, please start planning your life. Please start coming up with plan B and plan C. There are other options. Yeah. Now, a few, I don't want to encroach into the other speakers' area, but what's happening is, like I'm one of the senior doctors here. My medical officers do come and talk to me, and being one of the members of the psychiatric postgraduate board in the country, I do get a lot of questions from my fellow trainees as well. There are some of them who have resigned, and they have been employed in the universities, and they are actually pursuing their training there, and they are working as well as doing their training, and they liaise with the Ministry of Health, as what Dr. Sharon said just now about their postings and so on and so forth. So that's one option. The other option is finish off your training, get your head of department to support you, and try to extend. And it's JPA that actually is working with this contract. KKM is also doing their very best, and MMA is doing everything, I know, because I know you guys, and I know the effort that you all are putting in, and sometimes I bug you all too. So, the only way to deal with the anxiety of job insecurity is to start having other options. Yeah. If your plan A works, well and good. But if it doesn't, then, you do not want to waste your time. So rather than using that energy to be anxious, use that energy to look outwards and see what are the other methods that you can employ so that you're not left in the lurch.
Thank you, Dr. Gayatri. Before we move on to the next and the final question, for all our viewers, those who are signing up for the MMA membership promotion, please scan this QR code or access the link below, bit.ly/mfvs2143 to sign your attendance to be eligible for the MMA membership promotion. Now, the next question. Are these complaints confidential? I suppose these complaints regarding any workplace harassment and bullying. I believe many did not report as this may jeopardize their career advancement. What's your take on this?
Yeah, that is the main reason why many don't come forward and complain. You see, confidentiality to a certain extent, yes. At the beginning, maybe yes, but later on, if this case is taken up, then definitely it will have to be revealed, because you will need to put in your evidence. And if this goes up to MMC, then MMC will definitely call you, but they won't call you together with the perpetrator. But to a certain extent, confidence can be maintained at the initial part, but you have to be realistic. In order for this to go somewhere, then no. However, having said this, in 2018, when there was a major issue, I think most of you would remember, when one of the senior specialists was accused of sexually harassing the house officers under him, that spanned over a decade or so. The Ministry of Health did assure confidentiality for more people to come forward. And that was actually held and treated differently, because it was a major issue. It was something that was going on for years, and people were very scared because they were intimidated terribly. However, when it's a one-off thing where you are complaining about someone, initial part, yes, but later be prepared that it may come out, because it needs to be dealt with. Which is why I said that if you can get more people to join with you, because normally bullies don't just target one person. If you look at the history of bullies, and for those of you all who have gone through the bullying, incidentally, I did too when I was a house officer, but at that point we didn't have the awareness. I didn't realize I was bullied until I took up this course with you guys a few years ago about bullying, and then I said, hey, wait a minute, I was bullied too, but I didn't realize it. So, anyway, it doesn't matter. But what I'm saying is, they don't do it just to one person, they do it to many people. Yeah. So find those other targets, go together as a group, so you are stronger and you don't have, but don't be scared. How can your career advancement be jeopardized when you are genuinely reporting something that somebody has done against you? Don't be scared. If ever there is anything like that happens, you are free to make a complaint. You have MMC, you have MMA, and these guys will take up your course. Yeah. And you have senior doctors in your hospitals as well. So you have the support, but you just have to be brave enough to come forward.
Thank you, Dr. Gayatri. Now, we've come to the end of the forum, and let's have a feedback session. So go on to the Slides platform, and let's fill up. How would you describe this forum in 1 to 2 words? So just keen, whatever you feel, just some feedback, either positive or negative feedback for us so that we can improve. We still have one more session next week as well.
Don't worry, we are open to negative feedback as well, but I hope this forum has been only bringing positive vibes.
Now, while you're keying in the feedback, a big thank you to our panel of speakers for joining us in this very engaging live dialogue session. It was a great opportunity to clarify plenty of issues that our doctors on the ground are concerned with. And a big shout out to National SCHOMOS Exco and my organizing team from the MMA Sabah branch, who have been working tirelessly behind the scenes to put this forum together. So we hope you enjoyed this session. So some of the feedback, informative, fantastic, awesome.
Join MMA. Yes, you all should.
But some still feel a bit dejected. We're saying still useless contract MO. But, well, there's still plans in the pipeline, so don't feel dejected.
We rest assure you that the Malaysian Medical Association will try our best and do our best to see what we can do in our means to see, to ensure that there would be some form or at least some avenues for you all to progress and advance in your careers. We're keeping our fingers crossed, and we will work closely with the government and JPA, and we hope that something will manifest at least by the end of the year or so.
Now, Sindil, do you want to tell them about next week?
Okay, so next Sunday in session 3, we will be covering the topics of promotion criteria, resignation and early retirement, EPF versus pension, medical indemnity and malpractice suits, locum criteria, specialist flexi-day and full paying patient, FPP criteria, right? So we'll see you next Sunday at the same time and same place. Tune in with us through the MMA SCHOMOS Facebook page or the MMA YouTube channel. And since Hari, he showed off his pantun skills all in the beginning of this course, I think I need to match up to it. So here's a pantun to end this session. Dari ward sari ke ward isolasi, patient dipindah pakai PPE. Sekian sahaja untuk hari ini. Pada minggu depan kita berjumpa lagi.
A big thank you to everybody, and let's meet you next week, same time, same place on the virtual channel, Facebook Live, as well as YouTube Live. And as we end this session, we will like to play one last video from our sponsors. Thank you.
Thank you.
The benefits of tocotrienols and the vast, everything from brain function, stroke recovery, to liver function, a particular interest of mine, to cardiovascular function, something that I see patient after patient. My own family, my mother's side of the family, we carry a genetic preponderance of cardiovascular risk. So it's something very personal to me. And to understand that there are ingredients, and we will say that this is one of the mercies of God, that He, Jalla Jalaluhu, has put into foods, things that are a benefit to mankind. And it's undeniable to me that this is one of them, tocotrienols.
Cancer is directly associated with aging population. As we get older, our body seems less able to prevent cancer from developing, and virtually all countries are experiencing an aging because of better health. Now, that makes this cancer as a part of the health problems that we contend with growing in size. Nutrition is an important part. Preventive health in various ways are helpful or important. But cancer itself is really becoming quite a serious issue. The epigenetics, or this new area of discovering the expression of our genes, suggests that there are some very important agents or epigenetic factors that might have a role in preventing disease in general, and specifically cancer. And tocotrienols have really come to the fore as an agent that might be quite important in preventing cancer. It's also been shown to be helpful in preventing other problems, aging and inflammatory diseases and vascular disease, as we've seen in the stroke study. So we're looking at tocotrienols as one of those epigenetic factors, as we understand epigenetics better, that could be very important in preventing and modifying cancer.
For women's health and for immune function, palm oil can play an important role with helping to balance an immune system, particularly if the immune system is overdriven, like in autoimmune diseases where the immune system attacks, and women are much more vulnerable to immune system problems. Also, it can help to balance out or promote an immune system that's sluggish as well. But women tend to have the overly aggressive immune system much more frequently than men do. So this could be a helpful agent, we hope. We would like to do more research to be sure about that. Palm oil is a wonderful nutritive value, high health fat. And a lot of women, particularly in Western cultures, tend to avoid fat, which is a mistake. It's a very healthy fat and totally safe for human consumption. We know this because it's used around the world quite safely and successfully. Healthy fats are the fats that help to promote humans to feel well or better, and in particular, the fats that our bodies can't make on their own. That would include that big category called the essential fatty acids, or EFAs, and it's really critical to have in your diet, you know, the foods that you eat every day, good quality fat. That's just an essential ingredient. That's a must. Unfortunately, years ago, there was some misleading research and really bad information that has tagged anything that contains any saturated fat as a bad fat, and palm oils got smeared with the idea of being some sort of a tropical oil and put in this category of unhealthy fat, neither of which is true. The saturated fats that are in palm oil, along with the essential fatty acids and the other nutritious fats that it offers, are all healthful and good for humans. They're great.